If you have to get a knee surgery and you want to come out of it with the best results possible, then here's 3 things that you need to do before your procedure. Hey there, Coach Tyler here, and I'll just come out and say it. Having knee pain sucks, right? The only thing that sucks more is having to get a surgery to fix that knee pain. And trust me, I really get this. In fact, I've injured both of my knees and have undergone 4 knee surgeries to get where I am today. So, I do know a thing or two about knee pain and knee surgeries and how to make them feel better. Which is why today I'm going to focus on 3 things that you should do before getting a knee surgery. This is extremely important because most people don't think much about preparing for a knee surgery. Instead, they think about what happens after. However, there are 3 things that you can and should do that could have a big impact on how quickly you recover from your surgery so you can get back to living your life pain-free. Those 3 things are minimize inflammation, get as strong as you can, and make sure you are flexible. So, here's how this video is gonna work. First, I'm gonna go over 3 things that I actually use every single day to help minimize inflammation in my body. Then, I'll go over my favorite bodyweight lower body exercise that you can use to strengthen your hips and thighs so you have an easier time rehabilitating after your surgery. Finally, I'll go over my 3 favorite stretches for the lower body that you can use to stay flexible, which should also help speed up your recovery. Now, before we dive in, I do want to make sure that you check in with your doctor prior to trying any of these 3 things out. You should do this because I don't know what kind of knee injury you have. So I really don't want to make recommendations that would run counter to the advice of your doctor or surgeon. However, after you get the thumbs up, feel free to try any or all of these 3 things to prepare for your upcoming knee surgery. Thing number 1, minimize inflammation. Okay, here's the truth. Whenever you have a surgery, you'll experience a large amount of inflammation in your body. And one of the best ways to reduce the amount of inflammation you'll experience after your knee surgery is to make sure you don't go into your surgery with any excess inflammation right now. So, here are 3 things that I do on a daily basis to try and minimize inflammation in my body. First, you need to stay hydrated. Your joints love water, so please drink up. And I would aim to consume a minimum of 64 ounces of water per day. And if you really want to stay hydrated and help with your recovery, I would recommend aiming to drink closer to a gallon of water a day, at least for a couple weeks before and after your surgery. When you do this, your joints will stay more lubricated and your body will have an easier time flushing the excess fluids that are likely to happen after your surgery. Next, while prescription pain meds and anti-inflammatory drugs are likely going to be necessary for you, at least for a little while post-surgery, there's a spice that I take on a daily basis that's actually been shown to reduce inflammation in your body and, in a randomized controlled trial, has even been shown to reduce pain more effectively than anti-inflammatory drugs like ibuprofen. That spice is called turmeric. And the main ingredient in turmeric is called curcumin and has some amazing effects for health and reducing inflammation. I personally take 1,000 to 2,000 milligrams of curcumin per day, and it's made a huge difference on how my body feels. In any case, I highly recommend you start taking turmeric daily, as it will make a big difference on how your body feels. Now, the final thing that I do on a daily basis to reduce inflammation is manage my omega-3 to 6 ratio. Omega what? I know, these words sometimes sound confusing, but here's why this is important. You see, most people have heard of omega-3s like fish oil and the benefits you can get from it, right? But the reason why consuming omega-3s is such a good idea is because one of the markers of inflammation in your body is the ratio of omega-3s to omega-6 fatty acids that are in your blood. And in a perfect scenario, functional medicine doctors would like to see this ratio at 3-to-1 or less of omega-6s to omega-3s. However, most people in the Western world have a ratio that's closer to 30-to-1. So, by simply adding in an omega-3 supplement to your diet, you can improve this ratio and reduce the inflammation in your body. Now, you can go on Amazon and order any old omega-3 or turmeric supplement you'd like. Or, if you want to know the turmeric and omega-3s that I take on a daily basis, you can scroll down, click the link in the description below, and it will take you to the Warrior Made store, where we offer these two supplements in a bundle that we call the Inflammation Bundle. So, make sure you check that out either now or after this video is over, so you can check these boxes and reduce inflammation in your body. Otherwise, let's move on to the second thing that you should do when preparing for knee surgery. Real quick, before we get to the second thing that you should do when preparing for a knee surgery, I wanted to ask you for a real quick favor. If you're enjoying this content and you want to see more videos just like this, then take a sec right now and click the subscribe button and then click that little bell icon. And this way, you get an update every time we release a new video just like this. It helps us get noticed more, and our videos will help you transform your body faster. Okay, let's go back to the second thing you should do when preparing for a knee surgery. There's one lower body exercise that I like more than any other that will get your legs stronger than you can imagine. That exercise is called the one-legged squat. And while it's a very difficult exercise to perform, there are easier variations that you can use to work up to being able to perform it. So, if you want to make your legs as strong as possible, especially using just your body weight so you can do this exercise from the comfort of your own home, try each one of these exercises. Find one that feels difficult for you, which means you should be able to do about 10 reps with perfect form. Practice that frequently, at least 3 days a week, and you can start with 3 sets of 10 reps. And once it feels easy for you, go on to the next variation. So, the variations for this exercise start with an exercise called supported sit-to-stands with feet together. For this exercise, bring your feet together and bring your knees together. And as you squat down to a chair and stand back up, put your hands on your knees for support. Try to keep the weight about 70% in your heels and 30% in your toes, and try not to round your back as you go up and down. Move slow and controlled, and try to think about creating a lot of balance in this exercise as you practice it. If that's too easy, you can go on to the next variation. This variation is called sit to stands with feet together. And just like the last variation, it's the same movement, only this time you have to take your hands off your thighs and do this exercise just with the strength of your legs. So bring those feet together, bring those knees together, and come up and down, slow and controlled, to build your leg strength. If that feels too easy, then you can move on to the next variation, which is called squats with feet together. Again, all the setups are the same: feet together, knees together, making sure the weight's on your heels primarily, making sure you're tall to the top of your head. Only this time, instead of sit down in a chair and stand back up, you're gonna do the same exercise with nothing behind you, and you're gonna go as deep as you can. Don't worry about rounding your back too much at the bottom. This shouldn't be a problem for your back. Instead, try to think about how far can you go down while keeping your feet flat on the ground and still with about 70% of the weight on your heels. It's gonna require more flexibility, so be patient if you're on this step. Now, once you've built the flexibility and the strength to be able to do squats with feet together through a full range of motion, you can go to the next exercise, which is called 1 down, 2 up sit-to-stands. For this exercise, you're gonna bounce yourself on one foot. Try to keep the weight on the back of the heel, primarily about 70% on the heel and 30% on the toes. You're gonna lift the other foot in front of you, and you're gonna push your butt back and slowly come down to a chair. Go slow and controlled, and really try to focus on using the muscles of your legs and your glutes to be able to accomplish this. When you go to the bottom, put your feet together, just like a squat with feet together, stand back up, and go to the other side. Repeat slow and controlled, and build that strength. After you do that, you can do alternating one-leg sit-to-stands. This exercise is just like the one before it, where you balance on one foot, putting 70% of the weight on your heels and 30% of the weight on your toes. Only, you're gonna come down to the chair, very slow and controlled, and then stand up on one leg. Take your time, move slow, and make sure your knee is going the same direction as your toes. Again, feel the muscles work, and work on form first and intensity second. Make sure to alternate legs on each repetition, And if it feels too easy, then you can go on to the last and final variation, which is alternating one leg squats. For this exercise, you're gonna stand on one leg with no chair behind you. You're gonna go all the way down as deep as you can while keeping your foot flat on the ground and making sure your knee is going the same direction as your toes. As you go down, inhale. As you stand up, exhale, squeeze your abs, squeeze your hands, squeeze your glutes, and extend your hips to that top position. Alternate sides, and again, go slow and controlled. And this way, you can really build extremely strong legs so that you're ready for anything. Hey, before we get to the last thing that you should do when preparing for a knee surgery, I wanted to mention that if you like the way we broke the last exercise down into simple steps that you can take to slowly strengthen your muscles while also improving your flexibility, balance, and coordination at the same time, well, then you'll love the workouts that we send to our members over at warriormade.com. That's because our workouts are like having a personal trainer built into your phone, tablet, or desktop computer. Every exercise in our workouts is customized to your current level, which means you can have a workout program that can be used both before and after your knee surgery because it will meet you where you're at. So, to give our follow along home workout system a try, just click the link below either now or after you finish this video and you can try it for free on me. Otherwise, let's jump into the last thing you should do when preparing for knee surgery. One of the best ways to prepare for a knee surgery is to be flexible. So, right now, I'm gonna show you 3 of my favorite lower body flexibility exercises that you can do to create flexibility in your lower body and feel amazing at the same time. Now, the first exercise is called the boot strapper. And what you're gonna do for the boot strapper is you're gonna bring your feet right outside hip width in a squat stance where the toes slightly turned outward. From there, you're gonna hinge at the hips, come down, and you can either grab your shins, your ankles, or all the way down to your toes. Any of them is fine, but only go down as far as you feel comfortable. Don't strain your back and round your back coming into that bottom position. From there, whatever you ended up grabbing, you're going to extend your legs fully, stretching your hamstrings, and then squat down to the lowest squat position you can handle with perfect form and without pain. If this hurts, then don't go so low. Do a smaller range of motion. Inhale as you go down, and if you want to, you can exhale here too. And just relax to get flexibility, and then inhale as you go up, and exhale here, and relax to get more flexibility there. You can repeat this for anywhere between 10 to 20 slow and controlled reps, and then move on to the next stretch. The next stretch is called the hip ham stretch because it stretches your hips and then it stretches your hamstrings at the same time. So, to do this exercise, come into a kneeling position where the back leg is up and down and the front leg is at a 90-degree angle. So you'll see angle here, angle there. From there, what you want is to square your hips up. Don't let them tip from side to side like this. I don't want this hip hiking up and this one down, and I don't want you opening your hips like this as you go through the exercise. So square them up nice and forward like this, and it should feel just like your pelvis would feel if you were doing a squat on 2 legs. From there, you're gonna bring your body forward, stretching your hip flexor as far as you can. Take a deep breath, let it out, and then take a deep breath, and let's push back to the hamstring stretch position. So now you're gonna straighten this lower leg. If you need to scoot it forward, you can, and come down. You can grab your toes if you can. You can put your hands on your knee or your shin if you can. And again, exhale and try to come down as far as you can, stretching that hamstring as much as possible. You're gonna go back and forth between these 2 positions about 10 times on each leg, going slow and controlled, and trying to go a little bit deeper with each repetition. Also, if this bothers your knee on the backside, go ahead and put a nice soft pillow there so there's nothing to bother your knee. Now, once you've done 10 reps on the left, 10 reps on the right, slow and controlled, stretching that hip flexor and the hamstring, then move on to the next one, which is straddle side bends. Straddle side bends are one of my favorite exercises to stretch and strengthen the entire body, especially the insides of your thighs. So, to start, sit on the ground with your legs out to the side. If this is too difficult, you can sit on a chair, or on a stool, something to lift your butt off the ground a little bit, and it will take a little bit of pressure off of the hamstrings and the insides of your thighs. From there, what you're gonna do is you're gonna bend from side to side, attempting to touch your toes with each hand. Exhale as you hit each spot, inhale as you come back up. Exhale as you hit the spot, come back up. And your goal would be to get to the point where you can bring your head all the way down to your knees. And once you're able to bring your head all the way down to your knees and back up, to really create that flexibility, then you can start bending to the side by trying to reach your left hand towards your right foot and your right hand towards your left foot. So that looks like this. At first, you bring the left hand across and really try to stretch as much as you can. You'll feel a deep stretch all the way along the inside of this thigh and along the outside of your upper body right here. Come from side to side, again, nice and slow and controlled, and try to go a little bit deeper every time you come from side to side. The ultimate goal is for you to come all the way over, reach, and be able to grab your toes and pull your body down towards your knee as you go from side to side. Now this might take a long time, so be patient, go slow, and practice this drill over and over again so you can create flexibility and you can make your body feel good. Okay, there you have it. 3 things you can do when preparing for knee surgery. I really hope all 3 of these things helped you recover faster and helped you get better results from your procedure. If they did, please come back and leave a comment and let us know what happened. We love hearing from our followers. And since the topic of this video is so specific, I would really love to hear what happened when you tried out the 3 things that I shared. Also, if you're wondering what the best thing for you to do next is, make sure you check out this video right here. Inside this video, I'll teach you the best way to exercise for people who have knee pain. This will be extremely helpful for you to know after your surgery, as the first 2 steps I'll share with you in this video go over how the knee joint works and how to make sure you're properly distributing your weight across your foot so that you don't put any excess pressure on your knees. So make sure you check that out now so it's fresh in your mind for after your surgery. Otherwise, thanks again for watching, and I'll see you soon in our next video together.